if you will, successfully implemented even during the pandemic. So I think this is a very good fact that despite the pandemic, we are able to implement these activities, and we are hoping that all of these activities can be replicated in collaboration with AIMST as well. And this, I would like to extend my gratitude and thanks to especially Professor Aprilita, who is the coordinator for this MOU signing and the webinar today. So the MOU signing will be followed up immediately by an international webinar that also will be broadcast live on YouTube. So our students do not necessarily have to join the Zoom, but they can also participate and listen to the webinar through YouTube, which is broadcasted live. I thank the speakers on this webinar as well. And of course, I welcome all participants, all students who will be participating in the webinar and listening to the webinar. I hope it is going to be a fruitful presentation and a fruitful discussion, but more importantly, a fruitful collaboration between the two universities. I guess that's all the opening and introduction from International Office of Esa Unggul. I hand the time back to Panji. Silakan Panji.
Okay, thank you so much, Ms. Prita Suyudi, for the opening remarks. And ladies and gentlemen, let's take a look at the next opening remarks that will be delivered by the coordinator of the webinar and the Dean of the Faculty of Health Sciences Universitas Esa Unggul, to Professor Dr. Aprilita Hinayanti, APT and Biomed. Time is yours.
Thank you, Panji. Is my voice clearly?
Yes, it is clear.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Peace to all of us. The Honorable Rector of Universitas Esa Unggul, Dr. Insinyur Arif Kusumamang Praja MBA IPU, Vice Rector for Learning and Cooperation, Mrs. Endah Murtiana Sari, Vice Rector for Research, Development and Innovation, Dr. Muhammad Farodin Arozi, Director of International Office, Mrs. Prita Suyudi, Dean of Faculty of Physiotherapy, Dr. Wahyudin, Head of Nutrition Science Study Program and a speaker of webinar, Bapak Dudung Angkasa, and the honorable guest from AIMST, Vice Chancellor of Chief Executive of AIMST, Professor Dr. John Anthony Xavier, Deputy Vice Chancellor, Academic and International Affairs, Professor Dr. P.K. Rajesh, Deputy Vice Chancellor, Students Affairs, Associate Professor Dr. Ramesh Kumarasan, Chief Operating Officer, Mr. Ambi Habati Ratnan, Dean Faculty of Light Health Profession, Associate Professor Dr. Yusewa, Deputy Dean School of Physiotherapy, Ms. Jensi Suda, Deputy Dean School of Nursing, Ms. Rajeswari Sinasami, Head of International Office, Ms. Sarma George, and speaker of webinar from School of Physiotherapy, Mr. Kasra Singh, and the honorable of all of participants. Alhamdulillah, praise and gratitude we pray to Allah Subhanahu wa Ta'ala, because for His mercy and grace we can gather virtually via Zoom to attend the virtual MU signing and international webinar collaboration between Universitas Esa Unggul and Asian Institute of Medicine, Science and Technology, University Malaysia. It gives me great pleasure to welcome you to the signing of the Memorandum of Understanding today between Universitas Esa Unggul and the Asian Institute of Medicine, Science and Technology, University Malaysia. Today's signing set a significant milestone for closer research and educational collaboration among two institutions to carry out several collaborations in education, including sharing academic knowledge and best practices, staff and student engagement, fostering partnership and long-term relationship between institutions. As the beginning of collaborative activities, we create a virtual MU signing ceremony and a seminar titled Interprofessional Collaboration in Health Science. As we know, interprofessional collaboration occurs when two or more professions work together to achieve common goals and is often used as a means for solving a variety of problems and complex issues. The benefit of collaboration allow participants on to achieve together more than they can individually, serve larger group of people, and grow on individual and organizational level. Collaboration potentially reduce self-sufficiency in environment, demanding great flexibility and innovation. In healthcare, it is generally believed that collaborative effort yield better health service and outcome for the population that are served. I hope that the collaboration between Universitas Esa Unggul and the Asian Institute of Medicine, Science, and Technology, University Malaysia will build closer collaboration and ties to harness each other's strength to pioneer interprofessional collaboration in research and in education. I believe such collaboration is both timely and relevant. I also believe that this international partnership will encourage a new wave of development in health sciences at Universitas Esa Unggul. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Akulita, for the opening remarks. So, ladies and gentlemen, the honorable guests and participants, before we continue to the Memorandum of Understanding signing, let's take a look at the video profile of Universitas Esa Unggul.
Berdiri sejak tahun 1993, Universitas Esa Unggul telah menjadi salah satu kampus swasta terbaik di Indonesia. Kini, Universitas Esa Unggul memiliki 15.000 lebih mahasiswa yang terbagi di 4 kampus. Sebagai kampus utama, Universitas Esa Unggul Kebonjeruk memiliki 10 fakultas. Kampus Kebonjeruk juga memiliki sarana dan prasarana yang mampu menunjang proses belajar mengajar, seperti laboratorium yang dilengkapi dengan perangkat terbaru, perpustakaan yang terakreditasi A, dan juga fasilitas lain. Universitas Esa Unggul Kampus Citra Raya merupakan kampus kedua dari 4 kampus yang ada dalam naungan Universitas Esa Unggul. Diresmikan sejak tahun 2015, Universitas Esa Unggul Kampus Citra Raya hadir dengan jurusan-jurusan unggulan dengan akreditasi A. Jurusan-jurusan tersebut antara lain Teknik Industri, Teknik Informatika, Sistem Informasi, Manajemen, Akuntansi, Humas, Marketing Komunikasi, Ilmu Hukum, Psikologi, Pendidikan Guru Sekolah Dasar, Desain Komunikasi Visual, dan juga program Pasca Sarjana khusus untuk S2. Kampus ketiga berada di Bekasi. Universitas Esa Unggul Bekasi memiliki fasilitas yang memadai dan juga tenaga pengajar yang profesional. Kampus ini menjadi jawaban masyarakat akan perguruan tinggi yang berkualitas. Sebagai komitmen untuk mewujudkan kampus dengan kualitas terbaik, Universitas Esa Unggul memiliki gedung kampus baru dengan 41 kelas dan dilengkapi dengan berbagai laboratorium dan fasilitas lainnya, seperti laboratorium gizi, di mana mahasiswa dapat langsung belajar bagaimana mengolah sebuah makanan yang sesuai dengan standar gizi yang baik. Sebagai perwujudan visi untuk menjadi world class university, kini Universitas Esa Unggul telah membuka kampus khusus internasional kelas di Majestic Point, Gading Serpong, Tangerang. Lewat program internasionalnya, Universitas Esa Unggul Kampus Gading Serpong akan mempersiapkan mahasiswa agar memiliki kemampuan intelektual yang tinggi, kreatif, serta siap bersaing secara global.
Mari bergabung bersama ribuan mahasiswa lainnya di Universitas Esa Unggul, di mana Anda akan dididik bukan hanya menjadi orang yang cerdas dan intelektual, tetapi juga kreatif dan mempunyai jiwa kewirausahaan. Serta Anda akan siap terjun untuk menghadapi berbagai macam tantangan global. Be smart, creative, and entrepreneurial.
Heading up next, we have the welcoming speech from the Rector of Universitas Esa Unggul, who will be delivered by Dr. Insinyur Arif Kusuma Amang Praja, MBA IPU. To Dr. Arif, time is yours.
Okay, thank you, Mr. Panji Kustiawan, for your time. Honorable Vice Chancellor and Chief Executive of Asian Institute of Medicine, Science and Technology, University, Professor Datuk Dr. John Anthony Xavier, Deputy Vice Chancellor, Professor Rajesh, and Associate Professor Ramesh Kumaresan, and also Chief Operating Officer, Mr. Ambiha Bati Ratam, the Dean of Faculty of Allied Health and Profession, Associate Professor Dr. Yu Chewa, Deputy Dean of School of Physiotherapy, Ms. Jensi Suda, and Deputy Dean, School of Nursing, Ms. Rajeswari Sinasami, Head of International Office, Ms. Sarma George, and Speaker of the seminar, Ms. Trasal Singh, and also Mr. Dudung Angkasa from Istanbul University, my dear colleagues, Vice Rector, Dean, lecturers, faculty members, students of Universitas Esa Unggul who attend this event. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, good morning for all of you. Greeting from Jakarta. First of all, I would like to praise the Almighty God for giving us guidance and blessing so we can gather here to conduct MoU signing ceremony between Universitas Esa Unggul of Indonesia and Asian Institute of Medicine, Science and Technology of Malaysia. And also on behalf of Universitas Esa Unggul, I would like to express my gratitude and my highest appreciation to Professor Datuk John Anthony Xavier and team for the time and effort to attend and to the MoU of all collaboration signing ceremony between Universitas Esa Unggul and Asian Institute of Medicine, Science Technology of Malaysia. We hope that this collaboration will provide benefit to not only both our institution, but also our stakeholders, students, government, business, industry, and also both our society, Indonesia and Malaysia at large. Ladies and gentlemen, we are happy that we have a collaboration with institutions that have many in common from courses we offer, especially in the field of health and science. And then I hope through this collaboration, we can exchange our experience and knowledge in conducting a good learning process and higher education practices. And hopefully in the future, after the pandemic, we are going to make a physical reciprocal visit in the form of student exchanges program, and also staff exchange program, and also in the form of maybe a double degree or some kind like that. Besides that, I feel very optimistic and enthusiastic that there will be some initiative in the future in research and also community service. Hopefully, there will be a faculty collaboration program, and in research and publication, there will be also a joint seminar and conference. And we are going to attend each other international seminar. Ladies and gentlemen, today seminar with the theme of interprofessional collaboration in health sciences is a clear evidence that mutually beneficial collaboration can work. I believe that the practical knowledge discussed in this seminar by experts and lecturers from both our institution will greatly contribute to our learning process and the capacity building of the students as well as the lecturer of both our institution, Esa Unggul University and also Asian Institute of Medicine, Science and Technology. And I have no doubt that by the end of this lecturing, all of us will be greatly benefited. In my final word, I will emphasize the importance of this collaboration once again. This collaboration indeed gives us, Universitas Esa Unggul, the opportunity to become a quality university. And I believe that this kind of benefit is also realized by Asian Institute of Medicine, Science and Technology. Because academics usually grows and work best through collaboration and stimulating one another, provoking one another through open-minded exchange of view, ideas, and invention. Perhaps we need to stimulate more discussion about how to ensure academic people in both our countries can cooperate more productively. And once again, we want to thank you, Professor Dr. John Anthony Xavier and colleagues from Institute Medicine of Science and Technology University. And we sincerely hope that today is the passage of an ongoing collaboration, which is not beneficial to both our institution and stakeholder, but also for bilateral relation between Indonesia and Malaysia. Thank you for your kind attention.
Thank you, sir.
So thank you so much for Dr. Engineer Arif Kusuma Among Praja, MBA IPU, for the welcoming speech. And our honorable guests and participants, now let's take a look at the video profile of Asian Institute of Medicine, Science and Technology University.
Education is for improving the lives of others and for living your community and world better than you found it. And it was this catalyst that created AIMST University. Imbued with the vision of its founder, Yang Amat Berbahagia Tun S. Samivelo, AIMST University has grown to become a premier private university in Malaysia, providing quality and affordable higher education for all. At our exceptionally beautiful Garden University campus in Samaleng, AIMST University remains our best learning and research facilities in the country. We are dedicated to providing the best healthcare, applied sciences, engineering, and business programs. Built at a cost of over 500 million ringgit, AIMST University is a jewel in the crown of MIED, ambitious, resplendent, and ergonomic in design. AIMST University has a good mixture of local and international students. A student complex, comfortable accommodation, a state-of-the-art library, a great hall, modern sports facilities, which include an Olympic-sized swimming pool, are all part of this ambitious plan. We work closely with industry to produce degrees that are relevant and closely aligned to market demand. This is also made possible through partnerships with prestigious international universities and institutions the world over. AIMST University provides a rewarding and exciting student life. We offer a truly international experience. At AIMST University, we are fully committed to your holistic development. We bring excellent learning modes to fulfill your academic needs. Your first experience driving into AIMST campus will instill confidence on the security. The campus security team protects the well-being of people and the security of property around the clock through a variety of measures, both on and off campus. The Faculty of Medicine is the first and one of the most illustrious faculty. The Anatomy Laboratory and Clinical Skills Lab are designed to enhance the acquisition of clinical skills. The Faculty of Dentistry is not only elaborately set up and well-equipped with modern facilities. There is also a dental hospital to complement professional dental education with clinical skills. The Faculty of Pharmacy offers up-to-date courses that cover a wide spectrum of pharmaceutical sciences. Students at AIMST University are exposed to rapidly growing information revolution and are equipped with the latest laboratory facilities. The Faculty of Applied Sciences, the Faculty of Engineering and Computer Technology, the Faculty of Allied Health Professions, and the Faculty of Business and Management reinforces AIMST University's image as more than a medical university. We teach world-class values to empower our students to be a game changer in the society. In a world where people, knowledge, and ideas move freely without borders, AIMST University creates infinite possibilities for you to make the right educational choices, to open up a world of endless opportunities. Our degrees are internationally recognized and have been making an impact throughout Malaysia. AIMST University engages local and international educators for their outstanding and holistic approach in their teaching and learning. Through our world-class education, our students have progressed to be successful, competent graduates. We also empower our students by collaborating with leading industry partners to shape a progressive culture to enable our students to perform exceptionally well. We inspire, nurture, and transform capabilities of all who walk on our path. On the threshold of the second decade,
AIMST University continues to strive and shape the future of the next generation. Join us today.
your pathway towards global prestige.
AIMST, educating tomorrow's leaders.
Okay, so we already know and watched the video profile of AIMST University. And now let's take a look at the welcoming speech from the Vice Chancellor and Chief Executive of AIMST University, who will be delivered by Professor Datuk Dr. John Anthony Xavier. To Professor Datuk Dr. John, time is yours.
Terima kasih Encik Panji Kustiawan for moderating this session very well. Yang berbahagia Dr. Engineer Arif Kusuma Among Praja, the Honorable and Distinguished Rector of Universitas Esa Unggul. Good morning, sir, and thank you for your kind words. Thank you for your warm reception of our university. And thank you for your commitment and dedication to move this partnership that we have forged to a higher plane of excellence. I also thank Puan Prita Suyudi, the Director of the International Office of Universitas Esa Unggul, for her opening remarks, for giving us an insight into what the university stands for, Universitas stands for, and what you are doing. Thank you, Madam, for the insights that you gave us about the university. We also thank Professor Dr. Aprilita Rina Yanti F., the Dean of the Faculty of Health Science, for her introductory remarks. We thank Dr. Wahidin, Dean of the Faculty of Physiotherapy, Encik Dundung Angkasa, Head of the Nutrition Science Study Program, for being with us this morning at this officiation ceremony of the virtual Memorandum of Understanding signing ceremony and international webinar collaboration between the Faculty of Allied Health Professions of the University of Science, Science, Medicine and Technology, AIMST, and the Faculty of Physiotherapy and Faculty of Health Science, Universitas Esa Unggul, Indonesia. And on my side, I also welcome my Deputy Vice Chancellor, Professor Dr. Ramesh Kumaresan. I thank Professor Dr. Yu Chai Wah, the Dean of the Faculty of Allied Health Professions, who has made all this possible from our side to forge this collaboration, this partnership with Universitas Esa Unggul. And also welcome our Deputy Dean, School of Physiotherapy, Ms. Jansi Sudha, the Deputy Dean, School of Nursing, Ms. Rajeswari Sinasamy, and all our faculty staff at our end, as well as the distinguished delegates and faculty staff of the Universitas Esa Unggul. Once again, Yang berbahagia Dr. Engineer Arif Kusuma, we thank you for taking this initiative to bring us together in this collaboration, in this partnership. You rightly said, sir, that we can learn from one another, and that in this academic world, we have to collaborate to move the frontiers of learning and teaching, as well as research, to a higher ground. We agree totally with you, sir, and we believe that this partnership will be beneficial for both sides. We feel that we will be more benefiting because you are a bigger university than us. You have 14,000 students. We have only about 4,000. So we have a lot to learn from you as to how to expand how to expand our university to grow to the size that you are already there. We also, sir, look forward to collaborating, especially in the field of physiotherapy. We are also very desirous to tap onto your core areas. We see that you are very strong in entrepreneurship, and we have a, a faculty of business management, and we are sure that we will be able to profit from the vast knowledge experience that you have gathered in the field of entrepreneurship. So we have a lot of areas that we could possibly collaborate. But as you rightly said, sir, we can immediately, once the borders are open, can go for student exchange. We can go for faculty exchange. We can even, as you said, sir, we can go for the development of dual programs. And I think these kind of exchange activities will surely enrich not only our faculty members, but also our students. And I think this is a good move, and we warmly welcome with open arms Universitas Esa Unggul as our strategic partner.
Thank you very much.
Welcome, sir. Thank you, sir. And we hope that today's signing of the memorandum of understanding will start us moving faster into this realm of collaboration, so that we can profit from the synergy of our partnership. Just to give you an insight of our university, we are close to the Thai border. We are about 100 kilometers from Thailand. So it's only about an hour and a half, and we can already hit the border. We are close to Pulau Pinang or Penang. That's only about 50, 60 kilometers. So we are a campus in a very verdant place. It's full of trees, very green, just like yours. And we welcome you, sir, to visit us. You and your team will be happy to receive you. And likewise, we are looking forward to coming over to Jakarta and to your universitas. We hope that today's webinar on health professions on the interprofessional collaboration in health science will be a success. Once again, we thank the Universitas Esa Unggul for taking the initiative to do this international webinar. And we hope that we will be able to equally respond in the future by hosting similar webinars and opening it up to our faculty and to our students. We thank the participants, we thank the speakers this morning. We wish them well, and we hope that everyone will profit from this international webinar. So in closing, Yang Berbahagia, Dr. Engineer Arif Kusuma, once again, on behalf of the university, on behalf of AIMST University, we record our sincere appreciation to you, sir, to your team, and to the Universitas Esa Unggul as a whole for partnering with us in this noble venture of improving, extending the frontiers of knowledge through research, teaching, and learning for the benefit of humanity. Thank you very much.
Thank you very much, sir.
Welcome, sir.
Okay, so thank you so much for Professor Dr. John Anthony Xavier for the welcoming speech, and the honorable guests and participants. Let's witness the signing of the MoU, which will be symbolically signify the establishment of cooperation between the two institutions, Universitas Esa Unggul and Asian Institute of Medicine, Science and Technology, or AIMST University. We all hope that with this signing and this MoU, Cooperation can be established that can increase knowledge in both countries and also establish scientific research cooperation for a better world. Please give a round of applause by sending the applause reaction on this Zoom platform for the official MoU signing between Universitas Esa Unggul and AIMST University. So please allow us to take the pictures for this MoU signing. Okay, thank you so much for documentation. So ladies and gentlemen, to Dr. Arif Kusuma Among Praja, we invite to greet and introduce the team or official from the Universitas Esa Unggul.
Oh, okay. Thank you very much for your time, Professor. Let me introduce my team from Esa Unggul University. The first one is we have the Vice Rector in Academic Affairs, Ibu Endang. Ibu Endah, silakan. And also Vice Rector in Research, Development, and Innovation, Pak Arozi.
Yeah. Thank you. Good morning, Professor Dato' John Anthony. I hope we meet the next future. Thank you so much.
Okay.
Thank you, sir. Yeah.
Okay, and then also Vice Rector in Student Affairs, Pak Ari Pambudi is attending this seminar. Okay, along with me come the director of 4 campuses. I think we have the 4 campuses in Jakarta area. The first one is, of course, Ibu Prita Suyudi is also the director of campus in Tangerang and also the director of international program. Bu Suyudi, Bu Prita, silakan.
Yes, a pleasure to greet you again. I am, in addition to the being trusted as the director of international office, I'm also managing the international campus. A pleasure to meet you all. I hope I can visit with all the students, my students, Malaysia soon. It's very close. We are neighbors and we are satu rumpun.
Yeah,
Thank
okay.
you, Director.
Thank
Okay,
you.
kemudian also the director of campus in Citra Raya in Tangerang area also, Pak Dihin.
Recording is progress.
Tadi saya lihat hadir ya, kalau nggak salah.
Ada Pak. Assalamualaikum warahmatullahi wabarakatuh. Good luck, Prof. Vice Chancellor. I hope this MoU is fun and good luck always. Thank you.
Oke.
Thank you.
Oke, perkenalkan diri aja, mungkin Pak Nixon, silakan. The Director of Campus in Bekasi area. Pak Nixon, please unmute yourself.
Thank you, Pak Rektor. Assalamualaikum warahmatullahi wabarakatuh. Good morning, Prof. John Anthony Xavier and Mr. Katra Salsi. Nice to meet you today. Selamat pagi, Pak Dudung, Bu Keseli, para hadirin sekalian. Semoga MoU ini webinarnya akan memberikan pemikiran dan peluang kolaborasi bagi kita semua. Hopefully, today's webinar will provide knowledge enrichment and collaboration opportunities between university researches. Thank you.
Okay, thank you, Pak Nixon. And also the last director is director of our digital campus, Ibu Diana Fajarwati.
Okay, thank you, Pak Rektor. Good morning, everyone. Good morning, Professor John. It's pleasure to meet you all. Yes, the digital campus is the new baby of Esa Unggul University, and I'm here from your video profile. I'm very glad that you are the first of hybrid university in Malaysia. So we want to learn more with you, Professor, and your team, how because we are still in the progress to make a hybrid campus in a digital campus. It's my pleasure. I hope we can meet face to face in the near future. Thank you, Professor and the team. Thank you, Pak Rektor.
Okay.
The pandemic has forced us to become hybrid.
Yes, yes, of course. And in Indonesia, as hybrid is, I think, is more popular, and that's why our university preparing for the digital campus. It's still a new baby in Esa Unggul University. Thank you, Professor.
Thank you.
Okay, thank you very much. And then also, along with present is Pak Wahyudin, the Dean of Physiotherapy. Okay, Pak Wahyudin, just introduce yourself.
Ya, terima kasih Pak Rektor, and good morning, Professor Dr. John Anthony Xavier. It's nice to meet with all of you from the university. And after the Rector and Vice Chancellor signed the memorandum of understanding, hope we can continue this cooperation in faculty and department level. Thank you very much.
Pak Wahyudin, ada yang mesti dikenalin Pak, Bapak yang kenalin Pak, anak buahnya Bapak
Pak.
yang hadir di sini. Nggak usah dipanggil aja Pak, silakan.
I will introduce my lecturer here, Miss Nuraini Dianoviati. She is a lecturer in musculoskeletal. I know that from your website that your strengthening in physio is about musculoskeletal, and I think we also have a strength in musculoskeletal in Indonesia, so we can collaborate our strengthening for next future. Thank you very much.
Thank you, sir.
Okay.
Thank you.
Okay. Ibu Aprilita, the Dean of Health Science. Bu Aprilita, tolong kenalkan diri dan anak buahnya Bu yang dikenalkan singkat ya Ibu, silakan.
Thank you, Pak Arif. Good morning, everyone. Nice to meet you all. I'm Aprilita Rinayati and the Dean of Faculty of Sciences, Universitas Esa Unggul. Silakan teman-teman dari Siskes memperkenalkan diri. Mungkin Ibu Heni, silakan Bu Heni. Please introduce yourself.
Yeah, along with Ibu Aprilita, present, the Vice Dean of Health and Sciences, and also the Chief of Senate of Health Sciences, Ibu Weka Gunawan, and several lecturers, from Health Sciences University. Okay, I think that will be all, Mr. Professor.
Thank you, Yang Berbahagia Dr. Engineer Arif Kusuma, for the warm introductions that you have given about your distinguished staff, and thank you for the kind words that they have expressed this morning. And we are sure that our collaboration is on a firmer footing now that we know them a little bit closer, a little bit more than what we knew of them before the start of this virtual memorandum of understanding. And thank you so much, sir. And we look forward to individually communicating with your staff, of course, duly informing you that we are making inroads into your faculty members. And we hope that this will give us a sense of informality to move our project at a stronger and a deeper level. And if you permit me, sir, I could quickly also introduce my team. Some of them are not here today because our classes have started. Like, for example, our Deputy Vice Chancellor, Academic International Affairs, Professor Dr. R.K. Rajesh, he sends his apologies. He has got a class today. But we have with us our Deputy Rector, we call Deputy Vice Chancellor of Student Affairs, Associate Professor Dr. Ramesh Kumaresan. He's also the Dean of the Faculty of Dentistry. Maybe I could call Dr. Ramesh to say a few words of greetings to our distinguished colleagues from this Universitas Esa Unggul. Dr. Ramesh.
Thank you so very much, Prof. And it's my honor to welcome all of you to this virtual meeting. And our Faculty of Allied Health Profession is doing a great act here. I think this collaboration, we will move forward to the next level. And we expect the students as well as staff from the university to meet us once the pandemic is stabilized. We would expect you to meet us. We will be here to welcome you. Looking forward for a good collaboration. Thank you so much.
Thank you, Ramesh. And of course, the man of the hour is none other than the Dean, Faculty of Allied Health Professions, Professor Dr. Yu Chai Hua. He is the man who has engineered this project from our side, and he is the protagonist of this whole partnership. Professor Yu, you would like to say a few words of welcome?
Good morning, our yang berbahagia, yang engineer Dr. Arif Kusuma and the team. Of course, our Prof VC and our team also. And I'd like to say a very big thank you to the Universitas Esa Unggul for giving us an opportunity to be fostering our partnership. Really, thanks from the bottom of my heart that we are given this very golden opportunity for us to collaborate in academic as well as a student exchange. So we hope that when the pandemic over, we were going to keep in touch in physical. And as what Prof. Ramesh said, that we are looking forward to welcome you to our university. And we also want to go and visit you one day. Thank you so much. Thank you.
Thank you. Thank you, Dr. Professor Yu. We also have with us the Deputy Dean School of Physiotherapy, Ms. Jansi Suda. She's been very long with us, some 15 years, and maybe I could invite her to say a few words if she's around.
Good morning, everybody. Good morning for whole team. School of Physiotherapy is very much like happy, and we are honored to have this collaboration. So we are looking forward a lot of academic collaboration as well as research. So we like to do a lot of international research with you, and we will be doing it soon. So like we are looking forward to end this pandemic so that we can have a physical contact with you and have a mutual exchange of students as well as staff. Thank you all.
Thank you. Thank you, Ms. Jansi Suda. We also have with us Ms. Sharma George. She is the head of the international office. So Ms. Sharma is involved in making our international students comfortable in our campus. So she helps arrange their welfare, helps arrange their documentation so that they will have a peaceful stay at the campus of AIMST University. Ms. Sharma, you want to say hello to our distinguished colleagues in Universitas Esa Unggul?
Yeah, thank you very much, Dato'. Good morning to everyone present. I'm Sharma, I'm the head of international office at AIMST University. I'm really looking forward for a lot of positive collaboration between our two universities, and I'm really honored to be in this session. Thank you very much.
Thanks, Ms. Sharma. So, yang berbahagia, Dr. Engineer Arif Kusuma, we were strangers. Now, after the introductions, after our ceremony, we are now friends. We are partners. And we now look forward to a very warm and intimate relationship with you professionally to build both our two faculties for the furtherance of research, knowledge, and teaching in the world. Over to you, sir.
Thank you very much. Mungkin saudara moderator, silakan.
Okay, so thank you so much to Dr. Engineer Arif Kusuma Among Praja and also the Professor Dr. John Anthony Sevier for letting us all know the team or official from both institutions. So, ladies and gentlemen, This is the end of MoU signing ceremony, which was done between Universitas Esa Unggul and AIMST University. And hopefully with this collaboration, the climate for education and research in the fields of health sciences and technology will be more advanced by collaborating. So the honorable guests and participants, we will proceed to the international webinar, which will be very informative and insightful. And before we start the webinar, I would like to read the rules for today's webinar. So the rules for today's webinar: first, please use the actual name. Second, please mute the microphone except those who will raise question after being invited by the moderator. Third, during this event, please turn on the video feature with the virtual background. Fourth, for participants who will ask questions or comments, please submit it in short sentences or via chat box with the format name _ institution _ questions or comments. And the last but not least, please fill the attendance on the link that will be given at the end of webinar session. So ladies and gentlemen, we will start the international webinar, which the topics is interprofessional collaboration in health sciences, and the subtopics are nutritional support for elderly with stroke in community setting and biophysical-social approach to physiotherapeutic approach. This international webinar will be led by our honorable moderator from the lecture of the Public Health Study Program, Health Sciences Faculty of Universitas Esa Unggul, Ms. Giseli Fionalita, SKM MSc. Before we proceed, I would like to read the short profile of Ms. Giseli.
Panji.
Yes, sorry.
Excuse me, Panji. Before we proceed with the webinar and introducing the moderator, I would like to invite the rector of Esa Unggul and also vice chancellor if they have other engagement that they need to be. Gentlemen, you are welcome to leave the MoU ceremony signing, because I understand that Pak Rektor, Pak Arif, will be in another meeting shortly in 5 minutes. And before that as well, I would like to just ask 1 second of your time to extend our invitation to Pak Syahrul Reza. I see him on the screen. He is a mutual friend of the two universities, and he's currently coordinating the cooperation between universities and lecturers in ASEAN scope, I think. Welcome, Pak Syahrul Reza. It's a pleasure to have you with us. Okay, Panji, I give the floor back to you. Thank you.
Thank you, Rita, for your kind understanding, accommodation, and your foresight in releasing us from much as we would like to continue to stay and enjoy the seminar. As you rightly say, Yang Berbahagia, Arif, myself, we have other meetings lined up. And with your permission, Madam, we would like to take leave. Thank you so much.
Thank you. Same for me. So, thank you very much. See you, sir. Oke, terima kasih Pak Syahrul Reza atas kesediaannya Pak untuk hadir.
Sama Pak Rektor. Terima kasih Pak Arif. Siap.
Oke. Saya izin lift ya. Oke, assalamualaikum.
Thank you, Prof. Yu.
Okay, so thank you so much. Okay, so we will proceed.
Yeah, Prof. Yu.
Okay, so we will proceed to the webinar session. So before we continue, I would like to read the short profile of Ms. Giseli, the moderator for today's webinar. So her full name is Giseli Fionalita, SKM MSc. She graduated from Faculty of Public Health, majoring in Policy Administration Health in Universitas of Indonesia, and Master of Health Science, majoring in Health and Neurocognitive, University Science Malaysia, under Scholarship of Fellowship. So her professional experiences are research assistant in University Science Malaysia, consultant program in Health Integrated Early Child Development in UNICEF, lecture at the Public Health Study Program, Universitas Esa Unggul, and she has presented some of her research in international conference in South Korea, Brunei Darussalam, Malaysia, Thailand, and Indonesia. So this webinar will be led by Ms. Giseli. I will leave it to Mrs. Giseli.
Okay, thank you very much, Panji.
Okay, the honorable all the officials from both universities, lecturers, and the academician, distinguished guests, all the participants of this seminar, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh, and very good morning, everyone. It is an honor for me to join this event. It's one step to actualize the commitment of two universities into the collaboration, which we hope that we can create many more activities, research, and academic achievement in health science in the future. It is grateful even though we are facing a global issues in the pandemic currently, but we are still managed to make some good deeds as a collaboration by MoU signing that we were witnessing this morning. Ladies and gentlemen, my name is Giselle Ifianalita. You can call me Giselle. I am a lecturer in the Public Health Department, Universitas Esa Unggul. It is an honor for me to become your moderator for today's seminar. This seminar is about interprofessional collaboration in the health science. And as we know, interprofessional collaboration in health science is becoming a new era to partnership between those health researchers, health providers, health practitioners, and of course, the client or the patient themselves. And this collaboration is to create the interprofessional team that we can work together to improve quality of life of the patient or human in the general. So in order to obtain that, we are here represented by two speakers from the different background, but with the same vision to share knowledge about health science. First, we have Mr. Dudung Angkasa that will elaborate his presentation about nutritional support for elderly with the stroke in the community setting. And the second presenter is Mr. Kustrasal Singh. Apologize if I pronounce it wrongly. He is going to elaborate regarding biopsychosocial approach to rehabilitation, a physiotherapeutic approach. Before we started, allow me to announce the timeline for today. First, we are going to hear the presentation from both speakers in a row, and each speaker will be given until 15 minutes. And then we continue for another 15 minutes for the question and answer session. For those who have the question, you are welcome to put it in the chat box, or you can also ask directly to the speaker if there is a time available. Without further ado, let us start with the first session. Before I call the first presenter, I would like to introduce him, Mr. Dudung Angkasa. He is currently a head of nutrition department Universitas Esa Unggul. He completed his bachelor degree in the nutrition at IPB University Indonesia and master degree in the community nutrition at Southeast Asia Ministry of Education Organization Regional Center for Food and Nutrition Faculty of Medicine Universitas Indonesia. He has more than 6 years experience as teaching coordinated undergraduate courses, namely epidemiology, metabolism, nutritional assessment, and biostatistics. And also he has 1 year experience for teaching assistant for postgraduate course, namely clinical epidemiology and biostatistics at Universitas Esa Unggul. He also actively involved in the national and international societies such as Persagi, ASN, and Nutrition Society. He also acted as a national and international reviewer in the journals, in the some journal. And his research passion is actually mainly to the nutritional epidemiology with the emphasis on the vulnerable group, including the elderly peoples. Please allow me to call upon Mr. Dudung Angkasa. Hello, Pak Dudung. So in Indonesia, we usually greet using Pak instead of sir. So I will call you Pak Dudung. How are you, Pak Dudung?
Alhamdulillah, I'm healthy and, and
okay.
So yeah, burn up.
Yeah. So I believe that you are ready for your presentation, Pak. Okay. You will have 15 minutes. So time is yours. Are you going to share your screen?
Yes, I'm going to share my screen. Screen, I'm sorry.
Yes,
okay.
Please, Mr. Dudung.
Okay, wait.
Yeah, we can see already. Perfect. Yes, please, Mr. Dudung, time is yours.
Okay, hello everyone, and welcome to this webinar. It is a great honor for me to share today's topic, nutritional support for elderly with stroke in community setting in this beautiful moment. Today, in this today topic, we are going to look how the nutrition modified the health status of the elderly. And as just a brief of outline, we will talk. I will present first about the epidemiology perspective of malnutrition and also health problems among the elderly, and then we are going to talk about the risk factors, the possible risk factor, and then the third one is the main issue of this topic. Yeah, do nutrition matters for elderly people health, and also the risk of health problems. And then the last, we would like to share our community service work. This work is a collaboration between the Department of Nutrition and also the Faculty of Physiotherapy at our university. So this is an example of collaboration within the university, and for sure we can collaborate with AIMST University on next after this meeting. And the last is the reference. Okay, the studies show that population are going rapidly to be elder or going rapidly to aging, and the study shows that low and middle income countries are had a higher proportion of elderly if compared with the developed country ones. In Indonesia, Indonesia had the largest elderly population in Southeast Asia. Today, life expectancy in Indonesia is about 70, but I think I just checked the number in Malaysia. Malaysia is 76. Malaysia is higher the life expectancy in Malaysia, but the proportion of Indonesians is the largest because Indonesia is largest island. Yeah, and then it come to maybe trigger a question. Do the high proportion of the elderly indicate good health coverage? It can be true, but it can be the other way around. It can be true that the elderly, it can indicate that a national health system can control the infectious disease, as we know that back to 90s or maybe 2 decades ago, the most of the disease is caused by the infectious agent, such as the bacteria, virus, and we know that today we suffer from the pandemic of COVID-19, but by the proportions, the rate of the infectious disease is become lower, and the another type of disease as that we know, the degenerative disease or non-communicable disease, such as the ischemic heart disease, stroke, and also the diabetes, is give the biggest contribution of the total overall death causes in worldwide. So good or rapid aging population, if they go in the wrong direction, it can lead to another problem. As we know that in health statistic, all countries suffer from minimally double burden of disease, the undernutrition and also the overnutrition, particularly in developing countries. Okay, in epidemiology perspective or the cause of death perspective, the cause of death can be classified into 3 types. The first is the cause of death by the disease, and second is by the organ degeneration, and the last is by the injury and disasters and so on. But this second category is more interesting. Why? There is individual who had good health status until they die, they do not suffer from any disease. But as we know, as we going old, our system physically and also our metabolic or physiology is become diminished or become out of order. Yes, something simply like that. And for the elderly, they also suffer something that is called geriatric syndromes. My father just passed away a few months ago in June. Yeah, he also suffered from this geriatric syndrome. This geriatric syndrome can be classified into three to make it practical. The first is the ignorance. Almost all the elderly, they suffer from the ignorance, particularly after their pensions or post power. Pension or post power, maybe they when they active in university or institution or workplace, they have activities, but after they pension, they have no activities, particularly for the rural area. Yeah, and then it make the stress. Then the stress is contribute to their health status. And the second I is the impair of physiology or metabolism. Yeah, it is corresponding with impair of insulin, for example, insulin resistance, or impair of immunity that make the elderly become at risk for infectious disease. In my father cases, my father got some, actually just a small scratch in his arm, but this scratch, because not not properly treatment, it come cellulitis, and he went for the operative in the hospital, the surgery in his arm, and because my father had left weakness after his first attack of stroke in 2011. So he become more weak. He become weaker because his right hand is already get some another problem with the surgery. So a couple months before he passed away, he cannot. He still he bed rest, and it contribute to his death. Something okay. So I mean, it's not so emotional, but I mean the geriatric syndrome, the impair of metabolic, it will affect almost all elderly, and it can contribute to poorer health quality of the elderly. And then a study shows that almost a quarter of elderly are at a higher risk of malnutrition, and 20.5% of them are malnourished. The malnourished itself can easily can be two types. The first is the underweight, and second is the overweight. The overweight is more more to rural area, and for the urban area, they are tend to to suffer from overnutrition. Yeah, with high fat or high waist circumference, more than 100, and something like that. And then the malnutrition itself, it can increase the risk of degenerative disease, also the risk of infectious disease. In Indonesia, based on the basic health research, the prevalence of stroke in Indonesia is quite high. Yeah, it is for age range 65 to 74 is 45 percent per 1,000, and my father died at 76. Yeah, so my father among these ages 75 plus, and the prevalence is more higher among the male population. And then we continue to the risk factor of the cardiovascular vascular disease, because the stroke is included to this type of disease. The risk factor, it can be classified into two classification. The first is the unmodifiable risk factors. So
Sorry, Pak Dudung, you have 5 minutes left. Thank you.
Okay. Unmodifiable risk factor, but this is the modifiable one that can be our hope, that we can change our habit, because nutrition or health nutrition problems or related problems is mostly comes from the poor lifestyle or poor habit. So the main problem is the habit. And let's go to the main issue of this topic. Do nutrition matters? The study shows that the dietary risks, and we can see here the green one. It says that for the high systolic blood pressures, this one is a biomarker, a marker or indicator for metabolic health disease, and this one is related or linked to diet. And there are 6 another that you can see from the presentation. And then then let's see another studies show that the dietary management, for example, for DICE diet or Mediterranean diet, and high consumption of fruit and whole grains food, it can increase the risk of stroke or and even the diabetes, and even can improve the functional function of elderly. And then next, now I will share about our work. Our work is in a rural area. We give the RAS, rhythmic auditory stimulation, also balanced nutrition. Our intervention is giving the RAS, with and also the eating pattern and cooking demo. And at the end of our program, it's improved the STS. STS is sit to stand, and TOG is time up and go. If I'm not mistaken. And then improve ability to prepare healthy diet. And then in 2020, we also have these activities with a foundation. This foundation is a group of stroke survivors. We also doing the same thing, and the output improved knowledge of RAS and also the Gisela. Okay, I think that's all, Giselle. Thank you.
Okay, thank you very much, Mr. Dudung, for giving us such informative and interesting presentation. I believe everyone here are enlightened about how we can do to accelerate the recovery of elderly with a stroke. Can now allow me to welcome to the second speaker, Mr. Kostrasal Singh. Apologize again if I keep pronouncing wrongly. Before he presents, let me introduce him. He is a coordinator of postgraduate program in the School of Physiotherapy, Faculty of Allied Health Profession, AIMST University. He was graduated bachelor and master in the physiotherapy from RVS College Physiotherapy, Dr. MGR Medical University, India. He is currently employed as a lecturer at the School of Physiotherapy, Faculty of Allied Health Professional, AIMST University, Malaysia. And before that, he was employed in the School of Physiotherapy, College of Health Sciences, Mekelle University, Ethiopia. He is certified with so many training, mostly regarding the rehabilitation, physiotherapy, and neuromuscular. And regarding his publication, I believe I don't have much time to read it all, but I can see in here he has more than 30 international publications with some Scopus Index in the physiotherapy area of expertise. So without further ado, I would like to call upon Mr. Kostrasal Singh. Hello, sir. How are you?
Hello, ma'am. Thank you. How are you doing?
I'm fine. Thank you. So, sir, you have 15 minutes time for presentation. So I hope it will be enough. We are ready whenever you're ready. Time is yours, sir.
All right, ma'am. Thank you so much. So first of all, I'd like to share my screen.
Yes. Okay, we already can see it.
All right, all right.
Okay, perfect. Thank
Okay,
you.
so good morning to all dignitaries, senior fellow colleagues, and my dear students people around. Let's congratulate each other first, because we have reached to the new relationship where we are going to shape the next generation of both the country, those who are going to serve to the common people. So we have a great responsibility to do, which is coming ahead. So we are all very proud that we have reached to this understanding, and I'm sure in future we'll be doing very great. So without delaying much, let's come and talk about the topic for what we are here today. So actually, my topic is a little bit away from the normal track. This is called biopsychosocial approach. So before I get into the topic, I would like to tell actually what I'm going to talk today. So we have actually a two-way of approach that is called traditional methodology, what we practice day-to-day life, dealing in our physiotherapeutic, clinic or in any set of whatever we have. So the topic which I'm going to discuss, it is not so precise and correlated only to physiotherapy, but it is generalized to health sector, and it is globally in practice. So I believe what we're going to talk, if we all can incorporate in our day-to-day life practice, definitely our recovery rate is going to be very, very high. So why going through this presentation, only I have two objectives. One thing is I want to let you understand that you get understanding very well about your patients. About what, that we will see later. And so you understand very well about the patients, then you have better diagnosis. And once you have better diagnosis, definitely you are going to plan a good treatment. So this is the ultimate objective for talking about this. Now you can see biopsychosocial approach, what exactly it means. So let's see here. Actually, what actually it means is, here you can see, no matter what kind of patient or individual you are getting in your clinical patients, the patient reports to you with only one reason, that is pain. It can be with a different source and different type, but the pain is the ultimate issue when the patient reports to you. Of course, there are the other things also, but main thing is that in traditional approach, we only discuss with the biological aspect, which is this. Means the physics, where we talk about genetics, we talk about anatomy, we talk about physiology, neurochemistry, this, that, and so on. But here in this sector, we are not only talking about the physics, we are going to talk about your biology, that is your physics. Second and most important part, where the current world is talking about, discussing about, and implementing in different health sector, is mental health behavior. That is psychology. Not only that, we are limited, we have social and cultural context. So in this biopsychosocial approach, we are going far away from our traditional approach where we only talk about the biological aspect of the disease. We are going to talk about biology, what is happening in your physics, in your body. Then we talk about your mental health, how it is correlated to your psychology. Then your social relationship, which includes your family relationship and outside, and how it impacts on cultural contexts. When I proceed towards the next slide, definitely gradually able to explain. So here you can see this. Till now, we were talking only about this aspect, biological. But now we are supposed to incorporate psychological factor, which includes your self-efficacy, catastrophic thinking, hypervigilance, depression, anxiety, anger, socioeconomic station, social skepticism, social support, social learning, operant, and so many things are there. How it is correlated? I'll give you one simple case study example, which I came across. For example, in my previous job experience, I had one case, a 25-year-old male reported to me with history of right upper limb injury and difficulty in using it. He was a cop, you understand, so police. So when I was taking the complete assessment and all, I found out that there was a trauma in the brachial plexus. I'm sorry if anyone cannot understand this medical terminology, but I hope everybody can. So the brachial plexus injury, patient was having difficulty in lifting the hand in any direction, and he was a cop. So when he reported, in traditional way of approach, we just see that, okay, there is injury in the hand, patient having difficulty in lifting and doing the activities. But when you look at his face, what else you can find in that patient? What did I find? The psychological trauma which had. He was a cop. He's supposed to be physically fit to perform his duty. If his one part or one right hand is not performance, he is having risk of losing his job. I hope you understand, you follow me. And then if he's in risk of losing his job, definitely it's going to impact about the socio-economic status of his family, and ultimately it will relate to its social impact, the relationship outside. Again, if you continue this, then he will be burdened to the administration of social government or social system, which will lead to so many anxiety, depression, breakdown, performing so many antisocial activities, and so on. We can keep on talking about this. So now you can see the relationship, how it is going. It was just a biological injury, but leads to psychosocial trauma, then society, social impacts, and so on. So right now, through this approach, in biopsychosocial approach, we are trying to deal a human being not only about the individual injury or only to the physique. We are talking being human being as a whole system. That is the core concept of this biopsychosocial approach. And this is the latest trend with globally all the international and big healthcare systems are implementing, and they are getting a really amazing approach. As I told you, one more point here, you can see the biosocial approach, it is always a multidisciplinary team approach. Earlier, you go and just observe traditional approach. A patient comes to us, what we do? We just deal individually. So I'm sorry, I diverted a little bit, but I'm talking about that patient which came to me. So he was oppressed. We treated, so how we handle this? We called his boss and informed we need 3 months of time to make him ready to back to the job. Because while doing the assessment, we find out the injury is temporary, which can be rectified. And we convince the patient, we convince his boss. So see how we are diverting. We are treating the patient, we are socially informing his boss that yes, please hold on, do not fire him, give him some time to recover, which ultimately give him confidence in his face. So he got little bit confidence, so I'm not going to lose. 3 months time still we have. After 1 month, about different way of treatment approaches, there was sign of improvement and he got confident. I asked how is behavior in that house when I talking to his wife. He said he is very aggressive, not responding to anything. So you see a physical injury, psychological injury, and also socio-economic altogether. So at the end, when we treated the patient in 2 months of time, he was so happy, his smile was there, he saved physically, psychologically, socially, everything was impacted. So as a health professional, our job is not only to protect the biological aspects only, but we have to hold all together. That is the ultimate goal. So this is the traditional view, which we till now or we previously follow. But in case of biosocial view, now we are going to talk about this, all the aspects. We are going to incorporate the other aspects like psychology, sociology, cultural, and other aspects. So that when we treat individual, when the patient is discharged, he leave your campus or unit as a whole person, not as a systematic or you can say individual achievement at all. Now we correlate clinically. This is the general talk. We had a general introductory talk about that. Now, when we correlate, we just consider, just think about an individual who is having any kinds of illness. A physical illness will have so many emotional response, which is depression, anxiety, and fear. Depression, I will be all right or not. Anxiety, frustration, I'm not able to perform this. Fear, can I back to my job or not? So there are so many thoughts which will be keeps on rolling all around the mind. And when these thoughts are keeps on going in the mind, it will lead to what? It leads to complete disorientation of the person. So it is directly not only exactly the illness, but it's directed complete as illness, but not only the particular disease. That is the means I'm saying. So you have to think as a whole, not only the symptom of the problem. So when we approach, well, it's one thing you remember in mind. It's always a collaborative, multidisciplinary team approach. It is not an individual approach. A biosocial approach is combination of all the sectors. For example, if a person is coming with an injury to right upper hand, as a physiotherapy, we plan for our exercise therapy protocol, electrotherapy, and so on. But we may need some kinds of braces or other orthotic supports. We need it. We need occupational health support. We need nurses. We need a social worker. We need psychological health support, and so on. So there are so many people, those who are involved in bringing a person completely rehabilitated. And as a true professionals, I always suggest and recommend that whenever you treat a patient, please utilize the multidisciplinary team approach, a biosocial approach, because it helps you to fasten the recovery process or bring the patient back to his normal life sooner than our normal traditional approach. So you can see here, anxiety, fear, worry, acute illness situations, and negative influence, which means all the behavior changes will be there. When somebody is in anxiety, they're in fear and worry, what will happen? All the negative thoughts will be all surrounding. If somebody get toothache or say about to go and extract its tooth, then they have, oh my God, it's bleeding. How long it is going to take? I'm going to suffer a lot of pain and fear, anxiety and depression. So many things are going to happen. So my point here is, if anyone is ill, it's not only about a physical, but it is going to create a negative impact on the patient. That have to be remembered. For example, you see, definitely I agree. Illness also leads to physical deconditioning in the form of various diseases. Either it is sensory or motor or whatever you say. Of course, patient is going to have some kinds of pain, disability, and difficulty to perform his activities of daily living. That is, we call it as a physical deconditioning. But trust me, this physical disability is in the form of a strength, flexibility, and stamina. I agree. But this is not a whole thing. The main culprit behind this all is only one thing, and that is your mental deconditioning. You may have read so many stories. Yes, one cancer patient, just 40 years or 50 years old, they have defeated cancer. How you think the treatment is same for everybody, right? But some patients get true illness and some patients get totally recovered. How this happens?
Sir, sorry, you have 4 minutes left. Thank you.
All right. I'm sorry. I just pass on. So this is one thing that you have to remember. Yes. So that concept comes through the mental deconditioning itself. Okay, chronic illness, how it impact loss of motivation, family, physical activities, your career, lack of motivation will totally have impact on your financial burden and your performance at work too. So what could be the right answer of this type of problem? Of course, it's always a biosocial and approach. When we go through this biopsychosocial approach, recovery is going to be very fast. So what we're supposed to do? Recognize the relationship. Don't treat a patient as an individual, and don't try to use the word client, their patient, use their name. Approach with sympathy and emotion. You see how it is going to work. Self-awareness. Say, look yourself, feel the pain of your patient, and then you see your approach will entirely change. Don't treat them as an individual. When you take the history, correlate with the lifestyle. It is not only a matter of documentation. It is related to their lifestyle. So give that sympathy and emotion to them. They will be able to express more and more when they feel that you are listening to them. Understand? So it will promote complete patient's health when you try to implement these all things all together. So always remember, multi-dimensional treatment approaches, not individual. Don't be selfish in treating the patient. Okay, think only one thing, that your patient is supposed to recover fast. So what is the ultimate take from this whole presentation? Treat always a whole person, more important than focusing only on the disease. Mind, body, and soul. So I'm sorry, we can keep on talking, but due to strain of the time, I have to wind up my presentation here. So thank you very much.
Yeah, thank you, Mr. Castrosal. So many information that we can get actually, but however, we have some limitation of the time. Thank you very much for the outstanding presentation. I believe many of the participants, including me, interested in how we are practicing the biopsychosocial rehabilitation in the real life. Okay, ladies and gentlemen, now we come to the question and answer session. I'm sure that many of you will be interested to give some question that can be discussed with the speaker here. You can type it in the chat box, and or you also can ask directly, actually, if you still have time. Meanwhile, we're waiting for the question, I think I would like to ask question to Mr. Castrosal.
Yes,
so from what I heard, biopsychosocial rehabilitation is actually involving the feeling of the patient itself, right? So the feeling about regarding their pain. So how we can make the answer of the the patient reliable as the measurement, because it's going to depends on their perception, their perspective. So is there any pain education, or maybe you have any experience on that?
Actually, why not? Actually, what I believe the core objective of this program is to understand the patient first. For example, I tell you, I'm sure like in physiotherapy department, most of you will be dealing about pediatric cases. So have you ever experienced when you handle first day to the patient, how the baby reacts to you? It does take so long time to follow your orders, what you wanted to do. Baby doesn't do, okay, you lift your hand or do, baby doesn't do. You take a lot of pain and effort. So biopsychosocial approach say, no matter it is pain or disability or what, first of all, you develop a relationship with the patient. The confidence patients would feel like they are secure with you. They can trust you, they can believe you. Once they develop, and of course, this timing, my personal experience, in some patients, it may develop within 24 hours or first or second sitting itself. In some pediatric cases, I personally feel it takes more than 6 months. So during this period, we cannot even make any changes or any improvement. So patient get frustrated, or patients, attenders will get frustrated. So ultimately, we have to work on attacking on the psychological aspect, where we realize them that yes, you can trust me, I can help you out. If they realize, then definitely their confidence will boost. We are here boosting their motivational level and making them understand that yes, we are here to listen to you, not only related to physiotherapy, but if you need any other help related to health sector, then we are ready to assist you. At least we'll guide you what next you have to do. So this is how we can go on this lead.
That's true. So the trust is actually both works in the both way, right? So
Exactly.
it doesn't mean that the patient trusts us, but we as health providers also, we need to believe what they're saying.
Exactly.
So yeah, okay. Thank you very much for your
Most
answer.
welcome.
Yeah. So we're still waiting for the question. Perhaps any participants want to ask directly, you can raise your hand. Maybe the committee could help me because I cannot see who raising their hand. So if there is a participant raise their hand, can the committee might pin the participant. Maybe Ms. Hamida Ramawati want to ask directly. Because I cannot get the question clearly. She is the lecturer, I think. Ms. Hamida. Is Ms. Hamida here? Okay, meanwhile, while waiting, so we move to Mr. Dudong, I think. So Mr. Dudong, we are talking about the nutritional for recovery those stroke patients. It's just out of my curiosity. Maybe it's not a very scientific question. Is it true that if we are eating less, it's going to make our eating less, and will make them, the elderly, become a less disease?
Okay, thank you. That's a very interesting questions. Eating less, because maybe there is some, actually there's a study to say that energy restriction, it can contribute to longevity, to longer your age. The study is the fitness is still accumulating, but based on the physiology or metabolism, as long as you decrease the energy, but you still fulfill the micronutrient and others such as the antioxidant and protein, it could give the good impact, the health impact, the longevity. So yeah, in practice, we can maybe recommend for the elderly to have fasting, something like that, but we must still fulfill the micronutrient and so on, and also the protein and so on, something like that. But again, to have a great impact, we must combine or combine with other factors, because as we know, the vascular disease is not caused by a single factors. In epidemiology or today's sorry, including the COVID-19 is caused by multiple causations. Yeah, we know that there's host, agent, and environment, and also others type of models to describe how the disease is developed, and this model also can be true for to develop the health status. If we want to have good status, health status, we must what it's not easy to say. All factors must be taken, and then we must other factor we must collaboratively or in combination we must tackle all the risk factor, such as have a good nutrition, have a good physical activity, and also has good mood, good psychology, something like that. Okay, begitu.
Thank you. Yeah, of course, because if we are talking about health, it's like a multi-dimensional factor. That's why we have this seminar actually, so we can collaborate with each different background, educational background here. So we're still waiting for the question from the participants. The committee, could you help me? Is there any question from the floor? Or maybe there is some participant want to raise hand to ask directly to the speaker. Please do. Or from each speaker, do you have any question to each other?
Well, I actually like to appreciate Mr. Dudung for your such a nice inputs and ideas. Of course, you raised a very good question, Ms. Gisle. I was about to really, I was curious to know about that too. So already he answered, and really, Mr. Dudung, I got so many information from you. So thank you so much. It was really great.
Okay, also, yeah.
Yes, please.
Yeah, also thank you, Mr. Prasal Singh, for good presentation. Your presentation is mostly because the psychology is after we have what is it, bond with the patient or bond with the person, that it will be give big impact for the successful of the treatment. That's very good approach.
Sorry, Miss. I just would like to add one more point. Like, just because now we have, started new relationship, I'm open to any kinds of research activities we can do together in collaboration. In any field, no problem. Based on our understanding, we'll share and we'll help in publishing good articles in this field. So I welcome not only to the staffs, but even I welcome from your students also. And I invite you all, you come and see how we trained our master and undergraduate students here, not only competent to the national level, but international levels too. So we have certain expertise in placing our students internationally and guiding them. So I welcome you all. Come and see how we do that.
We love to. I understand that Mr. Dudung also have the project that he's presented just now is actually working together with the physiotherapy, right, Mr. Dudung? So I think your presentation, Mr. Kastrasal, will give so many more insight about the biopsychosocial rehabilitation. Okay, I think the times it's up for the Q&A session. So this is going to be the end of the Q&A session. Ladies and gentlemen, we finally come to the end of the seminar. So before I close the seminar, I would like to take a conclusion. The thing that I can summarize in here is that health is actually a multidimensional aspect. So it's going to involve many areas of expertise. So if we can cooperate and collaborate very well, will be more beneficial and easier to accomplish. I'd like to thank to the speakers for the informative and interesting presentation. And of course, thank you so much for all the participants. Apologize if there is any mistake from me. I am Giselle. Thank you very much for your time. Assalamualaikum warahmatullahi wabarakatuh. I give the session back to the MC. Thank you, Mr. Dudung. Thank you, Mr. Kastrasha.
Thank you, Mrs.
You're welcome.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Ms. Giselle, for lead the webinar session. And I would like to say thank you to Mr. Fatsal Singh and Mr. Gedung Angkasa for very insightful, and it's really opened the window of the science like that. So ladies and gentlemen, before we end today's event, please allow us to take pictures together for the documentation, and all participants are welcome to open the camera. Yeah, so for all the participants who can't open the camera, please turn on the camera for taking pictures together for the documentation. Okay, so I will lead the photo session. For the first page, please look at the camera. 1, 2, 3, smile. Okay, for the second page, 1, 2, 3, smile. Okay, the third page, 1, 2, 3, smile. Okay, for last page, 1, 2, 3, smile. Okay, thank you so much for all the participants who already opened the camera for taking us the pictures together. So ladies and gentlemen, the honorable guests and the participants, the international webinars have been done, and hopefully the webinars that have taken place can provide a lot of knowledge and be useful to all of us. So this is the end of the event. I would like to say thank you to all the guests and participants who have given their time and opportunity to attend this event. I am Panji
Thank you.
Yeah, thank you, Mr. Ratsal.
Thank you all.
So I'm Panji Gustiawan signing out. Sorry if I had a lot of mistake in guiding this event. Thank you and stay healthy. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much. Thank you very much, Mr. Dudung, Mr. Kastrasha.
Be smart, creative, and entrepreneurial. Be smart, creative, and entrepreneurial. Be smart, creative, and entrepreneurial.
Be smart, creative, and entrepreneurial. Be smart, creative, and entrepreneurial.